Hello, everyone. Am I audible to you people? Hello. Can you people hear me? Please respond. Dr. Barbara, can you hear me? Um, Guys, can you hear me? Okay. Thank you, Zainab, for your response. Okay. So, people, for today, our topic is derma. Before starting derma, I just want to discuss a few things that I have already discussed with you people before in my previous lectures. That always try to learn an approach. There should be a rough sketch or a rough approach in your mind, like where you want to start, how you want to take your whole history, and how you gonna end it. So there must be a few sections in your mind before starting or before preparing for any kind of topics regarding PLAB2, because that is very important to have a rough approach in your mind. Otherwise, without having approach, if in case you get a new case while in your real exam, or if you are unable to identify the case, like which one is it, so you might fail. So to be on a safe side, it is always advisable that always have a rough approach or a rough struct framework, like how you're going to cover all the sections in your history. You should have a rough framework in your mind so that you won't miss anything. Because sometimes when we start from the scratch, like when we start from the ABCD of the approach, like for the history taking approach, when we keep on asking all the questions related to all the sections, even if we do not know the exact scenario, or even if we are unable to find what is the actual cause or what is the diagnosis of the particular scenario, we might pass the station. Because if the examiner see that the candidate knows how to approach the things, and he is actually struggling to find the cause, he is actually struggling to show that he knows everything, he is trying to implement the knowledge or the he has previously about particular symptom or particular disease, then then the examiner is going to pass you. Okay. And secondly, don't sound scripted. Never ever sound scripted, because that is one of the major reason to fail this exam, even if you know each and everything related to particular topic. Okay. So starting from in the derma, there are two basic kind of topics you will see. Like the first one is the lesion, or you can say a swelling, and the other one is the rash. And for both of them, almost there is a similar, you can say, approach. So let's discuss the lesion first. So first of all, as we all always do for the other scenarios, like first of all, whenever the scenario or the stamp comes in front of you, you have to identify like who you are, where you are, and whom you are talking to. Like, is this the patient, or is this the relative of the patient, and what this says in your task. Okay, so these things are very important, because if you are sitting in emergency department, the approach you are going to deal with would be different. If you are sitting in simple GP surgery, the approach would be different. So you like there would be a little bit of difference, but still there is a difference. So you should know like where you are. Either you are in the emergency department, either you are in a dermatology specialist clinic, or are you in the simple GP surgery. So you should know where you are, and then whom you are talking to. Like, are you talking to the patient, are you talking to the relative of the patient, and then the task words, like what they are asking you. For example, they might be asking you, explain the results. But if the candidate has not learned it or read it properly, they might take it like a first visit case, and in that way they are going to fail the exam. So you have to be focused on the words. Then what you're going to do is, first of all, if the case is the patient is here for the first time, you have to start from the simple grips. Like, there should be appropriate start from your side. You have to introduce yourself in the very clear words and ask about the patient's identity. For example, how you are going to start is, hello. There should be a smile on your face, and there should be a very, a good tone, a very friendly voice of yours should be there. For example, you can't say hello. No. Be confident, and you have to use a very good tone, a very friendly tone when you are dealing with the patient. Hello, I'm Dr. Han, one of the FI2s in the GP surgery, and let me confirm your name and age. Okay, then she will reply, for example, my name is Mr. Smith, or blah, whatever. Then ask about, is it okay if I call you Smith? Well, nice to see you, Smith. So how can I help you today? Okay, so that's where you are going to proceed. But if it is the follow-up case, same, you have to paraphrase, like you have to set up a background. You have to recall a background for knowledge for the patient. For example, well, Clara, I can see that you have visited us before and we did a few tests on you. Before discussing the results, let me ask a few questions so that I can be in a better place to explain the results. Okay, is that fine for you? So that's where you are going to proceed with the follow-up cases. Now, okay, so here I have made a mnemonic for you because I know there are different approaches in the PLAB, in the different topics of the PLAB, and that is really difficult to, to learn each and every approach. So for or each and every case which presents as a simple lesion or as a swelling, you can use this approach. Like after grapes, light dark type of colors merge as smooth and plain. So what does it mean? You have to ask about the location. For example, the patient comes and say, doctor, I have a lesion. So how you're going to start it? Can you please tell me, Clara, where is the lesion? Or if it is swelling, and how many lesions do you notice? And then ask about the duration. For how long have you had this lesion? Then ask about the type of the lesion. Like, is it growing under the skin or is it growing at the top of your skin? Okay, the patient will answer these questions. And then ask about the color, because regarding any kind of lesions, the color is very important to identify or to differentiate between the different kind of lesions. So you have to ask all these questions. Like, what will you ask about the color? Where is it? What is its color? Is it the same as your skin color? And is it of the same shade? Or you can say, is the color is uniform? Because by asking these questions, you are actually identifying it, differentiating it from the benign from malignant one. And then ask about the margins. Clara, is it margins regular or irregular? How big is the swelling? Can you please tell me, is it the size of a coin or is it something larger, size of a cup? Can you please can you please let me know the size of the swelling or size of the lesion? And then progression. Have you noticed any change in size, color, shape in these recent years or in these recent days? And then ask about the associated symptoms. So associated symptoms are what? Like there could be itchiness, there could be any discharge, any bleeding. Okay, and you have to ask these questions as well, because by asking just these questions covering in these mnemonics, like light, dark type of colors, merge smooth and plain, like which depicts as location, duration, type, color, margin, size, progression, associated symptoms, you will differentiate your all, you will exclude your all differentials here. Because as you know, every kind of lesion, or you can say every kind of rash, the different DDs that comes around regarding particular lesion or particular rash, actually all these points are actually the pillar points, you can say, to differentiate between different kind of rashes. Okay, so that's why you should know these. And in any kind of scenario, if it is related to lesion, you are supposed not to miss any of these, because each and every question is very important. So what is it? Location, duration, type, color, margin, size, progression, and then associated symptoms. People, please learn this mnemonic, because derma scenarios are really important. They will come in your exam. So if you do not follow this approach, you might miss something. And by doing this, you might misdiagnose the patient. Okay, what comes next? Once you know that what kind of lesion is it, you have to find out the risk factors. So what are the risk factors for any kind of lesions? Like the main risk factors are either it is related to the person himself, or is it related to the family history. So you should have asked, like, what are the risk factors? There are particular 3 to 4 risk factors for every scenario in the derma. Like, do you spend a lot of time in the sun? Because sun exposure is the risk factor for a lot of rashes or a lot of skin problems. Do you have any moles in your body? If she says yes, then do ask, are they more in number? And if, can you please tell me which one, what is the size of the larger one mole? All right. Have you ever tanned your skin, either indoors or outdoors? Have you ever diagnosed with any sort of skin cancer? All these 4 questions are really important, because whichever scenario you will get, if you get the particular scenarios related to the cancer of the skin, you will get one point from any of them, because they will give you a hint. Then the family history is very important, and you should ask very sensibly. Well, Clara, I'm really sorry to ask the question, but is there anyone in your family who has been diagnosed with cancer? Because cancer, the family history of cancer is very, very important here. So do not miss the risk factors. So what are the risk factors? Some risk factors are related to the person himself. Like, for example, has he been exposed to the sun? Has there been a large number of moles present? If the large number of moles are present, how much are they? Are they in abundant? And then ask about, have you ever tanned your skin either indoors or outdoors? Or have you ever been diagnosed with any sort of cancer? And then comes the family history. Then the red flags, same. Do you have fever or night sweats? Do you noticed any lumps or bumps in your body? Do you have decreased appetite? And do you have any weight loss? Okay. So the next is psychosocial. Now, in the derma, the psychosocial point is very important, because whenever the person is having any kind of problem with the skin, there might be some impact on his mood. So this is actually the point. This point is actually very important, that will come under IPS as well. So you have to ask about the mood, how this has affected your mood, has this impacted your life somehow. So do ask these questions, people. And then comes your rest of the history. Like, again, as I always say, you are not supposed to ask all the questions, just ask the particular ones that are related to this. For example, smoking and alcohol history is very important here. Previous medical problems like diabetes, blood pressure is very important here, because if the patient is diabetic, he is at the risk of developing certain kind of rashes, certain kind of infections of the skin, as well as skin cancer. Family history we have already covered before, so no need to ask again. And then smoking and alcoholic history, that is very important here. Okay, so you are not supposed to ask each and everything, but ask a particular ones that are important. And also occupation is important, like what do you do for a living? And also, have you traveled somewhere? Because if the person is having Lesion or is having some kind of rash, there might be some contact history as well. So do ask these questions. So this is the rough approach. And again, further, like you do in the medicine scenarios, like you have to ask the patient, make it a habit of yours. Do you have any particular concern, or have I missed anything, or you want to add something here? Because by always, even if you are dealing with any kind of scenario, make it a habit to ask, do you have any particular concern? Because by asking this, you are going to save your words and you are going to save yourself. Because here comes what you are covering IPS point, and also you are actually acknowledging the patient concerns. So this point, this single line is very important, to pass the scenario, you can say. Then comes the assessment for the dermatology related scenarios. The blood, you would ask, like, I would like to check your blood pressure, pulse, temperature, respiratory rate, and also do mention that I would like to have a look at your lesion, and also I'll do a general physical examination, and I'll maintain your privacy, and there will be a chaperone with us. Is it okay for you? And there is no need of any kind of tests here. No need. There are a few scenarios in which we might need to do some tests, and I will let you know with the scenarios later on. Now comes the management. As you already know, that what comes under management, you have to disclose the diagnosis sensibly. You have to tell the decision, like either you are going to manage her on OPD basis, either you are going to make a referral, which kind of referral are you going to make, and then mention about the treatment options or management you are going to give to the patient, and then offer the leaflets, and most important is safety netting. And the follow-up is not important in all the scenarios related to derma, and we will discuss it later on. Okay, so the first scenario comes as the lipoma. So you are an FY2 in outpatient surgical department. Mrs. Moin, a 25-year-old lady, has a lesion. She has been referred by her GP. Take a focused history and discuss the treatment options. Now, the patient history, I had swelling, which is not painful, no color change, no discharge, no fever. The swelling is soft and can be pushed around. The edges are smooth and she's not on any medications. I want the swelling removed because I am gonna marry in a month, as my dress is with an open back. So questions. What are the options for the removal? Can I leave the swelling? Will it leave a scar? Are there any complications? Will it recur? And when will the result of the biopsy come? So The approach would be the same. What you are going to cover all the points like location, duration, what is the type of it, and when you are going to ask about the type, like is it growing on the skin or is it growing under the skin? There, here comes another question that you have to add on as an extra. Like, is it soft or hard in consistency? Are you able to move it or is it fixed on its place? Because that question is important. That's what is going to differentiate simple lipoma from something malignant. Then ask about, is there any change in the color you have noticed? How is its margin? Is it regular or irregular? Can you please tell me the size of it? And have you noticed any change in the size recently? And then ask about the associated symptoms, the particular ones that are actually linked here. For example, with lipoma, what could be the associated symptoms? Have you noticed any discharge coming out of it? Do you have any fever? Do you have any pain? Do you feel any kind of, have you noticed any kind of skin change over the lesion? That's it. And then about the risk factors, what are the risk factors for lipoma? We all already aware of it. What are the risk factors for that is, have you ever sustained any kind of trauma? That's it. You are not supposed to ask, do you have sun exposure? Do you have a family history of cancer? Because it is very clear by the history that the patient is saying, yes, doctor, it is mobile, the margins are regular, and the margins are regular, the size is this, and location is this, and I have not noticed any particular change in the size or the color of it. So there is no need to ask the irrelevant questions, just relevant questions you're supposed to ask, like, have you sustained any trauma recently related to your scenario? And then comes the red flags. Do ask just one or two questions, because you already know about from the previous history, like the patient has been telling you that it is most probably a benign thing. So ask just one or two questions related to red flags to just save your time. Like, have you noticed do you have any swellings anywhere else in your body? Have you lost any weight recently? That's it. And then a few questions from your rest of the history. And then comes the concise, like, do you have any particular concern, Clara? And then mention about the examination. So, well, Clara, I need to take your blood pressure, pulse, temperature, and respiratory rate, and also I need to have a look at your swelling to see what is it, and we'll do an examination from your head to toe, and I'll be maintaining your privacy, and there will be a chaperone with us. Is it okay for you? All right. And then when you will mention all these things, the examiner will give you the picture. If you will not mention the examination, they will not give you anything. So do mention about the examination, and they will give you that it is soft, mobile, under the skin, and the picture will be here. Now, what you are supposed to do is you are supposed to break the news now. Now, what is it? Well, you should know the basic way. You should know how to break the news, how to tell the diagnosis to the patient. Like, well, Clara, as you have, as on basis on what you have told me, that you are having this swelling and it is round and regular in examination, I have found it is very soft in consistency and it is mobile. So it seems like you have lipoma. So lipomas are what basically it is actually a soft fatty lumps that grows under your skin, and they are usually harmless. So you don't need to worry about it. At that point, the patient might ask, is it cancerous? You should know, well, Clara, it is not cancerous. It is really harmless, and it is just basically a painless, slow-growing lesion, and there's nothing to worry about. Let me reassure you. And then she will ask about the treatment options. Doctor, what are the treatment options available? You can say, well, first of all, lipomas do not need any treatment, but if you want to get treated, there are different options available. For example, you can get it removed surgically, in which they will numb your area locally and they will remove the lesion. But the on side effect of it is you might have a scar. And the second option available is liposuction, in which they use a needle and a large syringe actually to remove the fatty lump. But it is not usually done nowadays. So these are the two options available. But still, about the diet and the cholesterol levels, Sanab. Yes, Sanab, your question is valid. You should ask, because the causes, it is high chances of getting lipomas when the patient is actually diabetic or he's fatty. So you need to ask. Like, that's what you will cover in the PMMA Holy Family Desert Oil, like about the diet and about the previous medical history. As I have mentioned before, like, do you have diabetes or do you have blood pressure? And for sure you are going to ask about the diet. Then you will come to know either he might be having high cholesterol levels or not. So yes, you do need to ask, and you should have mentioned while explaining it to you. Well, these lumps are very common in the people who are actually diabetic or who have high cholesterol levels. So that's why the lipoma. So that's why you might be having lipomas. But it's totally up to you if you want to get it removed, or if you want to leave it that's way. Okay, so then the next thing would be you have to mention, even if the patient is asking or not. But here is the thing, Clara. Well, these are not usually treated on the NHS, and but you can pay to have a lipoma removed at the private clinic. But I'm afraid that it may be very expensive, because lipoma is something that is not harmful, so NHS is not pay for that. Are you following me? And then if she will ask a few questions, and you are going to ask the deal with that particular questions according to the scenario, and then afterwards you have to safety net the patient. You have to mention that, well, as I have mentioned, that it is harmless, but still, there is a very, very rare chance that lipoma turns into cancer, but the chance is very low. So if you don't get it removed, I would just recommend you to have a look for the following signs. Like if you notice any change in the size, any pigmentation, or any discharge coming out of it, please come to us for urgent assessment and then offer the leaflets. That's it. Okay, so that's what how you're going to cover the lipoma. That's it. Because in the lipoma, there is a very, very, very little chance of turning into cancer. So that is always better to mention that. If you are not going to remove it, then that's fine. But still, I would recommend you that do have a look for the following sign, like any change in the size, any particular pigmentation, and any discharge. And also, you will also mention here the test. Now, actually, I have missed here. I don't know why I have missed it, but you should have mentioned here the test as well. And secondly, what am I going to do is I'm going to run a few tests on you, like routine blood tests, and also the test to check your cholesterol levels and the blood sugar levels. All right, because as I have mentioned that these lipomas are common in the people who actually have diabetes or who have high cholesterol levels. So just to be on a safe side, to rule out, to look for these conditions, that's it. And then you will say that we are going to have follow-up after 1 week to discuss the test results. All right, that's it. So the next comes as, do you people have any question related to this scenario? Anyone? If I am missing something, people, I will be, telling you side by side with each scenario. So in this scenario, I just missed the part that you are supposed to run a few tests, like routine blood test and the sugar levels and cholesterol levels, to see if the patient is diabetic or has a high cholesterol level, because there is a kind of a risk factor, you can say, for lipomas. Now, the next come is the basal cell carcinoma and the squamous cell carcinoma. So first of all, you should know the difference between them. The basal cell carcinoma usually appears as a small shiny pink, because whenever this kind of scenarios will come, the only way to differentiate between them is if you know the risk factor as well as the morphology of the lesion. So you should know that the basal cell carcinoma appears like a small shiny or pearly white lump, you can say, and it has a very clear waxy appearance. And it also would look like a red scaly patch. And the most common history that they will give, risk factor that they will mention in the basal cell carcinoma related scenario would be that they might have a previous history of the similar lesion. Okay, whereas in the squamous cell carcinoma, the lesion that appears like a small lump, and it's kind of very similar with that of the normal skin color. And sometimes even a spiky horn sticking up from the surface, you can say, like reddish something, it will appear like the bleeding is coming out of it. So the appearance would be like this, and it will be pink lump with a rough or crusted surface. And basically, in squamous cell carcinoma, the risk of bleeding is higher as compared to basal cell carcinoma. And the most common risk factor that they will mention here would be the sun exposure. They will mention in the scenario that this is the patient is having sun exposure for the last 10 to 20 years, whatever. Okay. So the thing is the basal cell carcinoma. So let's discuss this scenario. If you are referred to in GP surgery, your patient is James White, 55-year-old with a skin lesion. Assess the patient and discuss the initial management. Okay, so assess the patient and discuss the initial management. So patient info. The patient has the lesion on the head for 6 months. Her wife noticed it and told her to get it checked. Works as a manager in the office. No sun exposure. Had similar lesion 3 years ago. Now, this is the very important point. 3 years ago, I had a similar lesion. I went to the GP and then froze my head. Now, the questions of the patient is, what is it? What do you think is the cause of it? It's the same as I had before. Should I get it removed? Now, what you are going to follow the approach is the same approach. You are going to greet the patient. You are going to ask about where is the lesion, how many lesions do you have, and for how long have you had this problem, and what is the color of it, what is the margins of it, and what is the size of it. Is it getting bigger in size, and the associated symptoms as well, like is there any discharge, is there any itching, and about the risk factors, very important. If you are not going to ask about do you have any previous history of similar kind of lesion, they are not going to mention that. Okay, so you have to mention these questions, and please just skip the part like I have mentioned type above, because it is just a mistake of mine. Also mentioned question, is it soft or hard? So just skip this line. Okay. So then you will ask about the risk factors, as I have mentioned. If you are not going to ask the patient, like, do you have any previous history of similar lesion or any kind of cancer, they are not going to answer this question of yours. Okay. And also ask about the other risk factors, any sun exposure, any history of tanning of the skin, indoor or outdoor, and do you have moles? How many moles do you have? Are they very abundant? You have to ask these questions. And then the red flags, for sure, very important. And then cover the rest of your scenarios here, the rest of your history. Here is the previous medical history is very important, because if the patient is having diabetes, or if he has rheumatoid arthritis and he is on some kind of immunosuppressant, it is also a risk factor for skin cancer. Here you are supposed not to miss these things here as well. And also the family history you have already covered before, you are not supposed to ask here. And then ask about the travel history. The occupation is very important, because in the skin cancer, the patient might have some direct contact with the chemicals. So do ask about the occupation as well, very important here. And again, the psychosocial history, like how has this impacted on you, on your life, or how is your mood. And then will come the examination, same as I have mentioned before. You are supposed to say the same way, like you are going to have a look on the lesion. You have to do a general physical examination, or you can say that I need to examine you from head to toe. And always mention that you are going to maintain the privacy, and there will be a chaperone with us. So these points are very important when you are covering this segment. So the examiner will give you this kind of picture, as you can see. Well, from the surface you can see that it's kind of a little bit crusted, and the appearance is waxy. Like from the sides you can see it's kind of waxy. So you have to have a very strong look on the pictures, because only by having a very good look on the pictures, or by able to differentiate on the morphologically on the appearance basis, you will be able to identify, is it basal cell carcinoma or squamous cell carcinoma. And the another hint for the basal cell carcinoma is he has had a previous history of the similar lesion 3 years back, for which the GP has froze that lesion. So the management is important. When you are going to explain the diagnosis, there is no need to follow the spikes protocol, like signposting. Like, it is not the Breaking Bad scenario. Basically, you are just suspecting it, so you have to be very just follow the suspected cancer or approach. Like, what will you say? Well, as you have told me that you had a similar lesion in the past, and from my examination, I have seen that the findings are this is whatever you will be seeing. I suspect that it can be a simple benign lesion, but it can be something serious like skin cancer. But we are not sure right now. So what am I going to do is I am going to make a routine referral to the specialist dermatologist. Now, most of you people might ask, like, why we are going to make a routine referral? There should be an urgent referral. No, that should be only routine referral. Because why routine referral? Because basal cell carcinoma has a very, very, very little tendency to spread to the other parts of the body. So we always make routine referral to the specialist dermatologist. Okay. So this is not urgent referral. You will learn in different from different notes that it is urgent referral. No, this is routine referral. And then you have to mention what specialist is going to do is they will do some examinations and a special test called biopsy, which is basically a minor surgical procedure where either a part of all the tumor is removed, so it can be studied under microscope. And are you with me, Clara? And this is usually done under local anesthesia, which means you will be conscious, but the affected part will be numb, as so you will not feel any pain. And if they will confirm that you have basal cell carcinoma, then they will do further tests. Then further tests are usually not required, as it is very unlikely that the cancer will spread. Now they might ask, like, what the treatment options available, doctor? So if they confirm that this is the cancer, the first specialist will do, they will decide the treatment option by considering the type of the cancer you have, the stage of the cancer, and the general health. Well, surgery is the main treatment, but non-surgical treatment options like freezing, anti-cancer creams, photodynamic therapy, some radiotherapy are also used in certain circumstances. The next question is it the same, doctor? Well, it can be the same thing, but needs proper investigation. Then, even if even after treatment, can it recur? So you have to tell the patient, well, once you have such lesion, there is a chance this will recur. So for prevention, there are a few things that you need to do. Try to avoid going out in the sun, limit the time outside, especially between the 11 a.m. to 3 p.m. And when you go out, cover yourself and also use a hat and apply sunscreen. Okay, Clara? So she might ask, what are the causes? Just mention 3 to 4, that's it. And then do safety net. Like if you develop any bleeding, please come back to us and offer the leaflets. And there is no follow-up. Oh, and also you can mention that if you are not seen within 3 months, just let us know. All right, that is what comes for the safety net. Otherwise, there is no particular safety netting other than bleeding. And then offer the leaflets. Where here the leaflets regarding different kind of like different lesions or the skin problems that can come because of the sun exposure. That's it. So the next is the squamous cell carcinoma. Anybody of you want to practice? Because it's the same like basal cell carcinoma. So anybody wants to practice? Anyone? Hello. Do you want me to pick out a few people? All right. So let me choose one. Okay. So Dr. Faraz Emma, do you want to practice? Dr. Faraz. Hello. Guys, please do practice, because by doing this kind of activity, that would be really helpful, because I have explained this approach you are supposed to follow. It is same as we have discussed about the basal cell carcinoma. The only difference is you are supposed to refer the patient on urgent basis within 2 weeks, and the patient will be seen within 2 weeks time. That's the only difference. So anyone wants to practice? Well, I'll do. Oh, okay, Zainab, unmute yourself. Let me start the timer for you. Just a second. Timer. Okay, so Zainab, you can unmute. All right. So your time starts now.
Hello, my name is Dr. Zainab. I'm one of the F2s in GP surgery. Can you please confirm your name and age for me?
Sure. Hello, doctor. Well, my name is Clara and my age is 62.
All right, Clara. Nice to meet you. So can you tell me what has brought you to the hospital today?
Well, doctor, I have a lesion. I have noticed a lesion.
Oh, I'm so sorry to hear about that. Can you please answer a few questions so that I can be in a better position to understand your condition?
Sure, doctor.
Okay. So, Clara, can you tell me where exactly is your lesion?
Well, it's on my shoulder.
All right. And do you have any similar lesion elsewhere on your body?
No, doctor.
Okay. And for how long has it been there?
Well, I'm not sure, doctor. My husband noticed it last week, and I just came here today. I'm not.
All right. All right. Okay. So can you please try to explain what type of lesion is it? Like, is it growing under your skin or on top of your skin?
Well, it is. I think it's on the top of my skin.
All right. And can you feel how the consistency is? Is it soft or hard or anything specific
Uh,
about it?
well, it's. I think it's soft.
All right. And have you noticed that what type of color is it? Is it the same color as your skin?
It's pink. It's more pink.
More pink. And what about its margins? Are they regular?
No, doctor.
Okay. Can you please try to elaborate what size it could be?
Well, it's the size of a small coin, I think. Yeah.
Okay. Okay. That okay. And so you just told me that it has been there for almost a week. At least that's when you noticed it.
Yes.
So do you have any idea that has it increased in size ever since?
Well, because my husband has just noticed it recently, so I think it might have increased in size. It might be very small in the beginning. That's why we haven't noticed before.
Okay. Okay. Do you experience anything, any symptom associate that you might associate with your lesion? Any pain or itching?
No, doctor, but now I feel like there is some kind of discharge, like yellowish discharge coming out of it.
All right. And the discharge is there all the time?
Almost, yeah.
Okay. Okay. Clara, I'm so sorry to ask you about this question, but can you please tell me, have you ever had any sort of skin cancer?
No, doctor.
Okay. And is there any significant history of cancer or skin cancer in particular in your family?
What are you saying, doctor? No, not at all.
All right. All right.
These questions.
Um,
Why are you
uh,
asking these questions?
I am so sorry. It's just part of the protocol. I need to be sure that I do not miss anything in
Okay.
that might be important. All
Yeah.
right.
Yeah. Okay, doctor. Hello.
Hello.
Yeah, Zainab, I'm, please.
Do you spend a lot of time in sun?
Yes, doctor. I just like sunbathing and I spend a lot of time under the sun.
And can you try to quantify for me like almost how many hours a day do you spend in sun?
8 hours, 6 to 8 hours. Like, yes.
Okay. Okay. And do you also tan yourself?
Well, I have tanned myself once, like
Or
15 years back.
all right. All right. Okay. So have you experienced any sort of fever or weight loss recently?
No, but I'm feeling a little bit feverish. But I have
Okay.
treated it.
Okay. And do you have any lumps anywhere else in your body?
No, doctor.
Okay. Do you feel this lesion is impacting somehow your lifestyle and how your quality of life?
Well, definitely. Like it's very weird whenever I am wearing like some open back dresses. Like it is apparent.
Mhm.
It is very ugly. It looks ugly.
I'm so sorry to hear about that. Have you had a similar lesion in the past before, or is it the first time that you are experiencing it?
It is the very first time.
All right. Do you have any significant medical history?
No, doctor.
Do you take any sort of medications routinely?
No.
Okay. Any allergies?
No.
Okay. Have you ever been hospitalized before?
No.
All right. And can you please tell me what do you do for living?
Well, I'm a housewife. I don't.
Okay. 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 Is anyone in your surrounding experienced similar lesion?
No, doctor.
All right. So Clara, do you have any particular concerns?
Well, I just want to know, is it cancer, doctor?
Okay. So before answering your question, I would like to take your observations. I would like to check your blood pressure, temperature, respiratory rate, and heart rate.
Okay.
And plus, I would like to examine your lesion. All
Uh,
right.
all right, doctor. Okay.
I would like to also examine you from head to toe, and I'll make sure that I keep your maintain your privacy, and there will be a chaperone with us. Is that all right?
Yes, thank you, doctor.
Okay. Um. Okay. So Clara, after examining your lesion closely and having a look at it, and from what you have told me that you spend a lot of time in sun and you have never had such lesion before, and this is the first time. Plus, you're also feeling feverish recently.
Mhm.
I believe that the cause of your symptoms could be cancerous.
Oh, oh, okay. So are you sure I have cancer?
No. For now we cannot say anything for sure. This is what I suspect. It is just a suspicion, but just to be sure, it is a suspicion based on your symptoms because a type of skin cancer might present with similar symptoms.
Oh,
So before saying anything for sure, I'm going to make an urgent referral to a specialist dermatologist. He will
okay.
be seeing you within a time span of 2 weeks.
Okay.
He'll be running a couple of tests. He might do a procedure called biopsy. Do you have any idea what biopsy is?
No, I have no idea, doctor. What is it?
Okay. Okay, they will be basically surgically removing a part of your lesion or the whole of the lesion, and they will be examining it under the microscope. And the plus point is that you will be conscious during the procedure because it is done under local anesthesia. So
Mhm.
the surrounding skin surrounding your lesion will be numbed, but you will maintain your consciousness,
Okay.
and that's it.
All right. So, okay. So, what are the treatment options available?
Okay, so based on what your final diagnosis will be, if they find that it is cancer, then it depends on the type of cancer, it depends upon the size and the stage of the cancer, how far it has spread. However, in most of the cases, the number one priority stays surgery. Will be surgically removing the lesion. And other options include radiotherapy, or they might be freezing the lesion, but all of that depends once the diagnosis is confirmed.
Okay.
All
So,
right.
yeah, thank you. So, Dr. Zainab, time is up. So, it was
Okay.
very good. It was really good. The only thing is when you say hello, just wait for the patient to reply hello. Okay. Because
Okay.
part of the IPS. And
Okay.
the only difference is the same that you are going to refer the patient and he will be seen within 2 weeks' time. That's the only difference between these two scenarios. Otherwise, everything is the same. And also, the one more thing, whenever you are suspecting the any cancer in the patient, you should have mentioned that I'm going to refer you, but not anyone who go to the cancer clinic the
Mm-hmm.
most with the cancer. You can take a friend with you. Okay, so because you have
Okay.
to relax the patient as well, so do mention that extra line as well. And it was good, Zainab. Your IPS is good, but you need to do more and more practice. Okay, because I think like the point that Dr. Hamid has mentioned, that a lot of times we say okay, this is basically we are buying time for ourselves. That's why we say okay a lot of time to
Mm-hmm.
practice, right? So try to
Mm.
use the different words as well. Like I have seen that you were saying after every line okay, so try to have different words as well, like all right, like you can use these expressions, body languages as well, to express that you are listening to the patient. Okay,
All
so
right.
otherwise it was good. And because the time was short, so you just missed the safety netting, and that's it. And
I want
I
to
was having a few
I
more
want to
questions,
ask
but there was no time.
I want to I want to ask something that, like, just now the time ended. I was
Nice.
almost done with the scenario, but I did not complete it.
Yeah,
Like, so does it impact the overall scoring?
yeah, Zainab,
That if
for
you're
sure.
unable to make.
Yes, it has an impact because the patient might have a lot more questions, like 1 to 3 more questions to ask. So for sure, that's going to have an impact on that. So
Mm-hmm.
so that's why what we say is you try to divide the time properly. Try to
Cannot rush our questions. Like, I missed a lot of questions in the systemic inquiry, and I only try to ask the relevant questions. But we cannot rush our questions as well. Like,
yes, yeah, you cannot rush the question, but you can simply say like you're not just supposed to always use the long sentences to ask for the particular symptoms. For example, you can say, do you have fever, any rash, any bleeding? That's why you might save a few seconds of yours. So that's how you can compress the history taking part of yours.
Okay, thank you so much.
You're welcome. And one thing more, Zainab, when you are explaining the scenario, I also mention the points that are actually the points to point that actually the main points that made a diagnosis of cancer in your mind. For example, when you have mentioned this, like based on this, if you have cancer, or I'm suspecting that it might be simple, or it might be cancer, then also mention that as you have mentioned that you have been spending a lot of time under the sun, so that's way the impression would be very good. So do mention the points that the patient has give you the clues that the diagnosis might be a cancer. So do mention these points as well when you are explaining the diagnosis, because that's way the expression you will give that will be really beautiful. Okay. All right. So Next comes the melanoma. Anybody wants to practice? Same approach, same scenario, just a bit difference in the management, and we will discuss it. So anybody else wants to practice, people? Anybody? Dr. Barbara, do you want to give it a go? Dr. Barbara. Guys, by doing practice, that would be, because if I'm keep on dictating you people, that won't help, because the approach is same. I would. Hera Ali. Okay, Hera, unmute yourself. I'm going to start your timer. Okay, so just a second. Sure. Just a second. Okay, so your time starts now.
Hello.
Hello.
Hello, my name is Dr. Hirali. I'm one of the junior doctors here.
Okay.
Can I know your full name, please?
Sure. My name is Harry Smith, and yeah, Harry Smith.
All right, Harry. And what would you like to call me, Harry?
You have already asked me Harry, so yes, you can call me Harry.
All right. Nice to meet you, Harry.
Same here.
How can I help you today?
Well, actually, doctor, I have a lesion on my shoulder, and that's why I'm here. So I'm concerned about that.
All right. So would you mind asking me a few questions about it so that I'm in a better position to assess you and answer your questions?
Sure, why not?
Yeah. So you told me you have the lesion on your left shoulder.
Yeah.
All right. Is that the only place you have lesion or any other place?
Well, it's only there.
All right. And how long have you been having this lesion?
Well, it was in the start, like it was very small on my shoulder for the last 10 years, but now I have noticed that it is increasing in size.
All right. I know it must be difficult. How about would you describe the lesion for me? How do you feel? Is it soft or hard?
Well, I think it's a bit, it's soft.
It's soft. All right. And is it under the skin or fixed to the skin or mobile?
Well, it is not a swelling, doctor. It is actually, just a patch of a skin, you can say, that is discolored, I must say.
All right. All right. And how about the color? What is the color of the lesion? Is it the same
Well,
as your skin?
no, it's brownish, light
It's blue.
blackish.
All right. And how are the margins? Are they regular or irregular?
Irregular.
Irregular. And the size? Could you describe the size for me? Is it about the size of a coin or maybe a ball or what?
Well, it's kind of 2 inches. Yeah, it's about 2 inches, you can say, in one dimension.
Okay.
Yeah.
And have you noticed the size being changing, or is it the same as it was before?
Well, I have already mentioned, doctor. I have noticed that it is increasing in size. That's why I just came to you today.
Okay. And any other symptoms with it? Is it painful?
No.
Okay, it's not painful. That's a good thing. And does it itch? Does it produce itchiness?
Yes. I'm having. It's itchy. It's
Okay. Okay, it's itchy. So you're uncomfortable because of that itchiness,
yeah.
right?
Yeah.
Okay. Okay, don't worry. We'll do something about that. And any other discharge?
It bleeds on touch.
Okay, so it bleeds. How much does it bleed? Is it too much?
No, but yes, it do bleed. I haven't quantified it.
Okay, and so what is your concern? Like, why do you want to get it removed?
Well, I haven't asked that I want to get it removed, doctor.
Okay,
I'm
okay, you don't want
concerned, like, what is it? Because it is increasing in size and now it is bleeding. So I just want to know what's happening.
all right, we'll get to that. Do you have any chronic illness?
No,
No, any diabetes?
no,
All right, any medications you are on?
no.
All right. Sorry to ask that, but do you have any family history of such condition?
Well, my father had a skin cancer. He's no.
Oh, I'm sorry to hear that.
Yeah, it's fine.
How is he doing now?
He's no more, actually.
Oh, I'm really sorry for your loss. I know it's difficult. So, did he died of the skin cancer, or did he
I'm
died
not.
because of any other?
I'm not sure, doctor. He. I think he had a heart attack. Yeah.
Oh, I'm sorry for that. All right. So, has this lesion affected your life?
Well, it is affecting my life because it bleeds on touch and it is very ugly, Lian, and that is very concerning for me. I'm unable to
So
wear.
that affects your mood
Yeah, it is affecting
as well.
my life.
Okay. Can I ask you what you do for your living?
I do nothing. I'm a university student.
Okay.
Yeah.
Okay. So it's difficult for you to study and, you know,
Yeah, to go on the parties and to wear my favorite clothes. I'm unable to wear my favorite clothes now.
yeah, okay, I understand it's difficult. That must be affecting your overall confidence and morale. Don't
Yeah.
worry. We'll look into that.
Okay.
All right. So, that that's it. But for proceeding more, I would like to take your vitals. That would
Mhm.
include taking your blood pressure, pulse, temperature, and respiratory rate. All right.
Okay.
And
Okay.
I would also like to examine you. That
Sure.
means examining your lesion and also your general physical examination. All right.
Okay. Yes. Sure.
Don't worry about your privacy. I'll maintain that, and I'll have a chaperone with me. All right.
Okay. Thank you. So here is Celine. He is vitally stable.
All right. So, Kara, from what I have asked, and what I have observed is, I'm sorry. Things don't seem to be so fine. Would you like me to proceed to your
Oh, doctor.
diagnosis?
Yes, what is
Are
it?
you comfortable to talk, or would you like
Stop.
someone to be with me?
No, I just want to hear it. What is it?
All right. So, Clara, I'm sorry. I believe I have a suspicion of it to be a skin cancer.
What? Are you sure?
I'm sorry. Yes. Um,
Um, you're sure,
I know
doctor?
it's difficult. Uh,
Mhm.
I'm suspecting it because a lot of the risk factors you told me they go with it. But
Oh,
for being it to be confirmed, I'll have to refer you to a skin specialist. All right.
okay, doctor. So what you are going to do for me now?
I'll urgently refer you to the skin specialist, and you'll be there within 2 weeks. All right. Hope you getting what I'm saying.
Yes, doctor. So what are the treatment
Okay.
options available and what the specialist going to do on me? Like how?
Yes, that's a really good question. I know you're concerned. I'll let you know. What they'll do is that just to confirm it, they'll take a
Mhm.
biopsy. Do you have any
Okay.
idea of what that is?
I think it's kind of the thing that you observe a tissue under the microscope. Yeah, I know.
Yeah, it's something like that. They'll take a sample from the lesion and they'll under it to observe it under a microscope. All right, but
Okay.
don't worry, it won't hurt. They'll numb it down, and they won't put you to sleep. All right.
Okay. Okay.
Okay, is that good for you?
Well,
And
yeah, and okay. All right. So, but if I do not want it
yeah.
removed, or if I don't want to go to the specialist,
Uh, see,
time is
Clara,
up.
it's
On to the next station. Time is up. Okay, so Hera, for you, the thing is, you
yes,
first of all you have to divide your time management is not good, your IPS is too good but your time management is poor, so you have to manage your time. You have spent a lot more time on history, and even if while spending a lot of time on history you miss the risk factors, you haven't asked about any risk factor that was very important here. Like when you are suspecting cancer, you have to ask about the sun exposure, because otherwise that is a blunder. You have to ask about the
yes,
for your indoor outdoor tanning, and especially in case of melanoma, moles, history of moles. That's very important. So you
okay,
missed it.
yes,
And also I have
oh,
the thing that I have noticed in your practices, whenever you practice, for example, I say I do not have that, and you appreciate that, that's good that you don't have that. There is no need to ask again and again, because you don't have much time now. So you have to be very smart in time management. Just don't be very quick in asking questions, but still don't be very slow. Otherwise you won't find time to deal with the management part. So please try to be a bit faster in history part. So just ask straightforward questions, and you don't need to appreciate the answer every time,
Okay, ma'am.
because you have
Okay.
noticed yourself as well that you whenever I say I don't have this, you say, well, that's good. Well, okay, you don't have it, you don't need to repeat it afterwards. Okay, but your IPS is
Okay, ma'am.
like when I mentioned that my father is no more, you stayed there, you ask about the cause of the death, and you have apologized for that. That was too good regarding IPS, but the management was not good, because you were not sure, like either you are suspecting or you are sure, because in the start you say I believe that you have this, and then you say, no, I'm not sure, I'm suspecting it, because I have asked
Okay.
the question twice. So be very clear in your management part. So I think you have to work more on the time distribution. Okay, so
Okay, ma'am.
the one thing is no need to repeat the patient answer. Second thing is, try to be more smart in asking the questions related to the history. So you should have much more time regarding management. Okay, so discuss the management part. So the management part is, oh, one thing more, Hera. When you mentioned about the examination, you mentioned that you don't need to worry about the privacy. No, that is not a good way to say. Just simply say, I need to take your blood pressure, pulse temperature, respiratory rate, and also I need to have a look on your lesion, and I'll also do your head-to-toe examination, and I'll be maintaining your privacy, and there'll be a chaperone with us. Okay, so just don't waste too much time on this as well. And the most important thing, Dr. Hera, you mentioned that why you want to get it removed. I haven't asked that I want to get it removed. So that sounds scripted. That's what the script is. That's what we say
Okay.
again, don't sound scripted. Even if you know, there's a 90% chances that in the real exam you will be able to know, while you will be outside the cubicle, you will know the what case is it. But try to be dramatic, don't like try to be very conscious about that, and don't show sound scripted, otherwise that would be not a good point for the assessment.
Okay.
Okay, so discussing about the management, when you are telling about the melanoma, even if you are sure, you are not supposed to say that I'm sure that this is, because without histopathological examination, you cannot be sure about any kind of cancer. You should have again use cancer suspected approach. Like as you have told me that you have multiple moles on your body, and you have noticed a change in the color, and now its border is also becoming irregular. And based on examination, I'm sorry to say, but I suspect that you might have a skin cancer. But it can be something less serious, but on the other hand, it can be a cancer, because sometimes the cancers also presents in this way. Then just wait a few seconds to just let this knowledge sink in, and then, well, being exposed to too much sun is a risk factor. So what am I going to do is I'm going to make an urgent referral to the dermatologist. You will be seen within 2 weeks' time. And what the specialist will do, they will perform a biopsy. And in case of melanoma, the whole of your lesion will be removed from the beginning. And you may have to test to check if the melanoma has spread to the other parts of the body. And for this, they might do some other test, that is sentinel node biopsy. And also they might run a few more tests like CT scan or MRI on you. Then they will ask what are the options available. So there are multiple treatment options available. Once they confirm it, if it gets confirmed, they will give you different options. The mainstay is surgery always, but it can be followed by the chemo or radiotherapy, and sometimes the targeted treatments might help. And after the treatment, there are regular follow-up appointments to check whether there are the signs of melanoma coming back, or melanoma has spread to the other parts, or there are signs of any new primary melanomas. And you may also be offered some immunotherapy to just prevent the melanoma from returning. And also, one thing more, if you have this lesion, there is a chance that it may recur. So for prevention, avoid the sun, limit time in the sun, cover your body, wear hat, apply sunscreen, and check for any moles on your body. And if there is any of the following sign, like if you noticed any border irregularity, any non-uniformity in the color, if you see the size is increasing, or there is any change in the shape, color, presence of new symptoms like bleeding and itching, please come back to us to get assessed on urgent basis, and let us know if you do not get checked within 2 weeks time. And if you develop any bleeding, please come to us on urgent basis. That's it. And then offer the leaflets. That's what you are supposed to do in this. So you have seen that the management is the same almost for all the three. I'll like just a little bit different. Otherwise, it's the same. So the next thing is papilloma. It is not cancer, but it is a simple scenario. So who's going to practice this? Anyone? Same approach. Anybody? Guys, in the two scenarios that we have discussed before, you don't need to ask about is it the soft or the hard, is it immobile or is it mobile. I have just type it by mistake in the PCC and SCC scenario, so you don't need to mention that. So the next is papilloma. Who is going to practice? Anyone? Guys, anyone? Dr. Naveed, Dr. Sudan. Guys, please be quick, otherwise I might have to move forward. No one wants to practice. Should I move forward? Hello. All right. So the next scenario is papilloma. So you are referred to in surgery OPD. Mrs. White, a 30-year-old woman, has been referred by the GP with the complaint of Lesion. Take focus history and discuss the treatment options available. So what the patient is, she is 30-year-old with the complaint of the Lesion of the left shoulder, and she wants it removed. As she's getting married in 1 year, and she don't want to have a scar or Lesion showing through the clothes, and there is no change in the color, size, and there is no itching or discomfort or any kind of bleeding from it. The question is, what will you do for me? What are the treatment options available? What do you recommend for me? Should I leave the swelling? Can it leave a scar? Any complications? So the approach would be the same. You will ask about the location, the duration, the type of it, the color, margin, size, progression, associated symptoms, and the risk factor. Same, all the risk factors you have to ask: sun exposure, tanning, previous history of cancer, any family history of cancer. And then do ask about the red flags. Do you have any swelling anywhere else? Have you noticed any weight loss, any loss of appetite, any fatigue, and how is it affecting your life, and why you want to get it removed? If she says that I want to get it removed, then do ask why you want to get it removed, and then how this has impacted your life or your mood. And then, do you have any particular concern, and then mention about the examination as you are doing for the other scenarios before. And the management would be, the papilloma would be like this. So you have to use very simple words to explain the management. So based on what you have told me and based on the examination, I believe that you have a papilloma, which is basically a benign skin tag, a small growth that hangs off the skin. These are common and harmless, and skin tags are made up of actually loose collagen fibers and the blood vessels surrounded by skin. And what I can do is I can refer you to the dermatologist, and also I need to run some blood tests on you, like cholesterol levels, blood sugar levels as well, because the man or the women can develop the skin tags, and they tend to occur in the older people and the people who are obese or have diabetes. So skin tags are harmless and they usually don't do any pain or discomfort. However, you may consider having the skin tags removed if they are affecting your self-esteem, or if they are causing you trouble. But NHS do not pay for that, because it is something that is not harmful for the life. But if it is affecting your physical or mental health, then NHS gonna pay for that. Otherwise, if you want to get it removed, choice is yours. You can go to the private clinic, but it might be very expensive for you. And the treatment options available are, sometimes it can fall off on its own. However, it can be burnt or frozen to get removed, but this might fail in some cases. So surgical removal has the advantage of remove it completely, but there is a risk of bleeding. Surgery is done under local anesthesia, and they will send it to the lab for microscopic tissue analysis. And if the skin tag is very small, sometimes the ligation might help. So what do you think about it? Do you want to get it removed? What do you think? So you have to engage the patient as well. So out of the patient might ask, like, what do you recommend for me? So you can say, well, out of these options, the best options depends on your size of the lesion, and for which the dermatologist will examine you, and they will suggest you the best option available. So that's why I'm going to make a routine referral for that. I will inform my seniors as well. Here are the leaflets, and if it bleeds or if it bleeds, you can come back to us, and I'm going to have a follow-up with you after 1 week to discuss the blood test. Now, one thing more here that I have missed, you have to mention that please do not try to remove it on your own, because otherwise you might develop serious bleeding, because that is actually a bit important point here. So you have to mention that here as well. So the next scenario is benign mole. Please, people, the same approach here comes. Please do practice. Anyone wants to, please give your name. Dr. Barbara, please give it a try. Dr. Barbara, same approach, nothing different.
Okay, I will try.
Okay, so let me just start the timer for you. Okay, so Your time starts now.
Hello,
Hello.
my name is Dr. Bra. I'm FI2 in GP surgery.
Okay.
Can I take your name and age, please?
Sure, my name is Mary Smith and my age is 25.
Can I call you Mary?
Sure.
Okay. Mary, can you please tell me what have brought you here today?
Well, I have moles and I want to get them removed actually.
Okay. Uh, before before seeing lesion, I want to ask a few questions. Is it okay for you?
Sure.
Okay. Mary, can you please tell me how moles you have and their location?
Well, there are multiple moles all over my body, but the few one are there on my shoulder. Actually, I'm going to get married within a week, and the Lesion, I just want to remove the one particular ones that are visible on my shoulder because my dress is actually backless, so I just want to look good, on my wedding day.
Okay, and for how long you have these moles?
Well, since my childhood.
Uh, did you ever remove any moles before?
No.
No, sorry, I should not use the word mole. Okay, and do you notice any change in the moles? Sorry, in the
Um,
lesion you have on your skin?
no, doctor. Is it the same as it was previously?
Okay, and uh, I want to ask few further questions. Do you have any sun exposure?
No.
Excessive exposure?
No.
No. And I'm sorry to ask, but do you have any previous history of cancer?
No, doctor.
Any significant history, past medical history?
Um,
Any disease you want to tell me, or any medications you have taken before?
no, doctor.
And do you have any history of cancer in your family?
No, doctor.
No. And what do you do for your living?
But I do nothing. That's why I'm
Okay.
married soon. Yeah.
It's congratulations for your upcoming future and for your marriage, Mary.
Thank you.
Okay. Before I want to do your observations. I want to do your BP, pulse, temperature, and respiratory rate, and I want to examine you from head to toe. But
Alright.
for examination, I will try to maintain your privacy, and I will arrange a chaperone with us.
Okay. Okay. So
Okay.
yeah. So the picture is not there, but it's a simple mole. No.
After taking history, after asking questions, and after the examination, I suggest this these lesions on your skin are simple moles which are harmless.
Okay.
As
So
yes,
so I want to
Mary.
get it removed, doctor. So how you're going to do it?
Yes, as I have told you, these are harmless, and we can remove them. I will. But there is, I want to tell you something. This is not comes under NHS. If you want to get removed, the NHS does not provide this facility, so you have to remove it in a private clinic.
Oh, okay. Okay.
And it will be a little bit expensive.
Okay. So is there other options available for that, like except the surgery? Is there anything else I can do to remove it?
Yes, Mary, there is another option. They can be get removed by chirotherapy or laser therapy
Okay.
under local anesthesia.
Okay. Okay.
And
So
this does
does the
not
surgery
yes.
sorry, doctor, does the surgery has any complications?
No. As I have told you, these are harmless lesions, and they need a simple incision to be removed, and it does not you surgeon does not provide you to anesthesia. It's all done in local anesthesia, and so it's a minimal procedure, so does not have complications.
Oh, okay. Okay.
Hopefully, it may leave a little bit scar,
Okay.
which will get settled with the
Okay.
time.
Okay. So, doctor, what caused these lesions? Like, why the moles are here?
No, Mary, this is by birth. This runs in the family. In some families, they are more prominent, but it does not have any tendency to be cancer. So it's a good news.
Okay, doctor. Thank you.
Do you want to have ask anything else?
No, that's it.
Does I've complete your concerns?
Yes, doctor.
Address your concerns?
No, that's it. That's it. Okay. So,
Yes, thank you.
Thank you. Okay, Dr. Barbara, the things that you have mentioned is you need to ask all the questions because you have to differentiate a simple mole from the melanoma. So you have to ask, you have asked about the location, duration. You should have asked about the type as well. Like, is it growing or something? Because she simply says that there is a lesion. Or if she says there is a mole, you should have asked, like, before considering it is a mole, please give me a history that if it is something that is growing under the skin or over the skin, and what's the color of it, and is the color uniform or all around, and what is the margin of it, is it regular or irregular, what's the size of it, you have already asked, I think. And then the progression, have you noticed any change, you have asked about the progression, but still you missed the questions about the uniformity of the color, the margins, you have missed that, and also the type as well. And then about the associated symptoms, you missed it, like any bleeding, itching, any kind of discharge, you have missed. These points are important. And then you do have asked about the risk factors, but you haven't asked about the whole description of the lesion. So that was the mistake of yours. You should have asked all these questions, differentiate the two things. And then comes the management. So when you are describing about the management, you have to explain it. Then these are what you have told me, and from my examination, the lesions are the benign moles, and these are generally harmless, and these harmless are not treated on the NHS. And when she asked, like, why am I having this? So you are not supposed to say that they are very common in the few families. No, this is not the answer. You can simply say, well, the cause is unknown. A few people have more of the moles on their body, but the cause is not known. But you don't need to worry about it because it is harmless. So let me reassure you that that's not going to have any kind of impact on you. And then when you are ending the conversation, if the patient, you have made the mind of the patient that if she wants to remove it, she has to go to the private clinic. But if you don't get it removed, you have to always keep a check on the following. This point is very important here to get good marks in the management part. Like, if you noticed any irregularity in the border, any change in the color, any non-uniformity in the color, if it is increasing in the diameter, and if it is any new symptoms like any bleeding, any itching, you notice, please do come to us for urgent assessment. That's it. And just offer the leaflets to the patient. That's it. Okay. So Dr. Barbara, you need to do more and more practice. Keep on practicing with the people. First of all, give a good read to your notes, whatever you are reading, and then do practice. Okay, by putting timer. So you need to practice more and more, and always please learn this approach by heart so that you won't miss anything, because each and every question is important here. Okay. So again, people, is it soft or hard? Is it fixed or immobile? This question is irrelevant. That is by mistake that I have mentioned it. I will send the updated ones after this discussion of ours, because that is not supposed to ask in these scenarios. In all these scenarios, this question is only relevant to the lipoma. Okay. So next is the seborrheic keratosis. So the seborrheic keratosis, same approach, same practice, same questions you are supposed to ask, but the only difference would be, she will ask, like the patient doctor will ask, when she asks where is the lesion, you have to ask the history of any kind of other problem of the breast. For example, you have to ask, have you noticed any lump? First of all, you will ask about the lesion, like from how long, where is it, how many are they, is it growing under or over, What's the color of it? What's are the margins? What's the size of it? Is it getting, have you noticed any change in the appearance of it recently? Any associated symptoms like any bleeding, any itchiness, any discharge? Any additional questions, and then ask the more questions, because the lesion is on the breast, and whenever this any kind of lesion is on the breast, you have to ask the particular questions about the breast, like, have you noticed any lump in your breast? Is there any discharge from the nipple, any bleeding from the nipple, and have you noticed similar lesion anywhere else? And then ask about the risk factors. Risk factors would be the same: sun exposure, tanning, and sun exposure, tanning, and also the family history, very important here. Any family history of any skin cancer or any breast cancer. Okay, so and the red flags would come, and then the psychosocial history, and then you have to examine the same way you have mentioned before, and then the management part. So what the management part is, so you will explain it from what. Oh, the one thing is, when you are mentioning the examination, you have to mention that I need to have a look on your lesion, and I will also examine your breast, and will do a general physical examination of yours. Or you can say that, Clara, to reach to know to reach the diagnosis, I need to have a look at your lesion, and I'll also examine your breast, and will do a general physical examination, and I'll be maintaining your privacy, and there will be a chaperone with us. Is it okay for you? Okay, so then comes the management. So for the management, the keratosis looks like this, as you can see in the picture. So from what you have told me on examination, I suspect that you have a skin growth called seborrheic keratosis. And do you know what is it? All right. So it is harmless seborrheic. It is a harmless warty spot that appears during the adult life as a common sign of skin aging. And but then the patient will ask, like, what is it, why it comes? So you say that the experts don't completely understand what causes a seborrheic keratosis. This type of skin growth does tend to run in the family, so there is likely an inherited tendency, and if you had one seborrheic keratosis, you are at the risk of developing the others, but it is completely harmless. This is a benign condition, as you have told me that you have a family history of cancer, and also you have a high exposure to the sun. Both of these are risk factors for the cancer. So not to miss anything serious, I am going to refer you to the skin specialist dermatologist, and they will ask you a few questions. They will do some more examinations like dermatoscopy, and they might send a biopsy, and then you can explain a little bit about the biopsy as you have been doing before. And then they will ask what are the treatment options available. Then you have to mention the word, like peeling is available, you can have the freezing therapy, there's a treatment in which they might burn the lesion, and they might shave the lesion, and they're different. By after proper assessment, you can decide what you want to go with regarding your treatment options. So the important thing in this scenario is the patient, whatever the patient is having, it's totally benign. But along with this, to confuse you, the patient will give the history that he has had sun exposure, and also he has a strong history of skin cancer. So that's why you are actually sending the patient in the 2 weeks time for assessment, because as the history is strong regarding the cancer, still you are suspecting that the lesion is benign, but you have to get assessment from the dermatologist, because it might be cancer, just to be on a safe side, because the family history is very strong. So that's where you have to, if you miss this point of skin cancer thing, then that would be a blunder. So you are supposed not to miss anything important what you get in the stem or in the scenario or from the patient. So the next is skin lesions with rheumatoid arthritis. Guys, this is the same scenario as we have discussed, like BCC and SCC. The only difference would be the patient will give a history that I have rheumatoid. When you will ask the patient that you have any problem, like any diabetes, any blood pressure, or any other problem, if the patient says no, you can also say, you have any problem with your joints? They might say, yes, I have rheumatoid arthritis. Then you need to ask about the rheumatoid arthritis. For how long have you had this? Is it well controlled? What medications are you taking? And then the other history you will cover the same way as we have done before. All the questions related to the lesion, and then the same, everything same. And then when you explain it, when you will mention about the examination, the examiner might give you a picture of BCC or SCC. The only difference would be the patient is here on the some kind of immunosuppressant therapy. So you have to mention here, well, after looking the lesion and from what you have told me, unfortunately, skin cancer also present this way. So I'm suspecting that you might have a cancer, but it could be something simple. But to be on a safe side, I need to refer you on urgent basis to the dermatologist, depending upon if the picture says it's SCC or if the picture says it's BCC. But if you're still confused, you don't need to, then don't take the name if it is SCC or BCC. You can simply say, I'm going to make an urgent 2 weeks referral to the dermatologist if you are confused. Okay. And then you have to mention that the patient might ask that why am I have this, and you can say, as you have told me that you have rheumatoid arthritis, Clara, and you are on methotrexate. What methotrexates do is this can weaken your immunity. Like your body is unable to defend itself against the different insults, different chemical insults or different infectious insults or different things. So that's increase your chance of getting cancer. So that's why so that might be the cause, but we are not sure whether it is cancer or not. So for this, you need to be referred to the specialist. That's it. Or the further treatment would be the same, like the SCC and BCC if they ask. That's it. Okay. So there is not a big difference between it. So the next scenario is scenarios are related to the skin rash approach. Basically, skin rash approach is a bit different as compared to the others. So you have to know that. So what's the skin rash covers it? It's the same mnemonic, but just you don't need to ask about the merge part. Light and dark colors merge, smooth and plain. So you can just, as you can see that I have highlighted the points that which are actually helpful to make a framework. So you have to learn the mnemonic. So from light location is where is the rash? When did it start first? And where is it now? So for the rash, that is very important. You should know like where is it now? And but still in the beginning, from where did it start? Because by asking these questions, you are going to differentiate between the different diagnoses, like between measles, between chickenpox, as you know, that they have a difference in the site of their appearance. Then where is it now? Then ask for the duration. For how long have you had this? What is the color of it? Has this happened before? And is there anyone else who has the similar rash? Because in most of the time, rash is something infectious, so you have to take the contact history. And then comes the prodromal symptoms, very important here. If you will miss any of these, you might miss the proper diagnosis. So please learn these points, as these points are very important to differentiate different DDs related to different rashes. Okay, so ask about the prodromal symptoms, like have you had any fever, flu, sneezing, or runny nose before the rash appearance? And then ask about the associated symptoms. Is it itchy? Is it painful? Is there any discharge, any bleeding? Have you noticed any lesion in your mouth? Very important here. And do you have a fever? And then the childhood vaccination, very important, people, because measles, as you know, for regarding the measles, the childhood vaccination is very important history. So you should have asked about the vaccination. Have you had vaccinated yourself? Yeah. Or if there is a child, you can ask for the mother, is your child up to the date with his vaccination? And then comes the rest of the history. Only very important points from you will cover from the rest of the history. Just ask the relevant questions, don't ask the irrelevant questions. And then here is just a quick review for you how the measles starts. It starts from behind the ear. The patient will give the history that it's the rash started behind the ear, and that it covers the whole of the body. And they might say that I do have a few spots, they might say, but they won't say in all the cases. But still, it can be a clue that I do have some spots in my mouth, and I do have flu-like symptoms before the appearance of the rash. Okay, for urticaria, they will mention that I was in contact with something, like either I was doing some gardening, or I was in contact with some with some tree, or or something has bitten me, and then afterwards I developed some rashes, and then it disappeared after a while. Or I have taken hot bath and it rashes appear, and then it's disappeared after 10 to 15 minutes. So they will be the pointing towards urticaria. Then scabies. For this, the scabies, they will, if you will ask, like if you say ask the history that where do you have the rash, they will mention that I have had in all around my body, between my fingers. Where do you will, then you will when you will ask about do you have any itching, they will mention yes doctor, it is very itchy. Then the next question you need to ask is to confirm the scabies is it gets worse at some particular time of the day, because scabies rash is very it is very itchy at the night. So you have to ask this question. By this, you can get a clue. And you also need to ask, like, is there anybody else who has a similar rash or similar problem? Then about impetigo, the sign would be, she will mention that I have a blister. And she will just mention blister. It is not painful. It is not itchy. And by doing the examination, you will come to know that by on the picture, the lesion would be yellow, honey colored crusted lesion. So for the chicken pox, she will mention, if you will ask, like it started from the face and spread it to the rest of the body, and the prodromal symptoms would be present here as well. The only difference that would be on the history in history point of view from between chicken pox and measles would be, chicken pox started from the behind the ear, whereas the measles, whereas the chicken pox will start from the face and then spread to the rest of the body. And then the acne, you already know the acne scenario would be very clear cut. She will be having rash on the face, on the back, on the chest. She will mention that properly in the scenario. So let's discuss the scenario. So the rash stations impetigo. So your FI2 in the GP surgery, a 28-year-old female has presented with rash on her face. Talk to her and address her concerns. So the patient info is, 2 weeks ago, she noticed swelling around the lips. Few days after the swelling, she started getting blisters. It is not painful. It is not itchy. No medical history. She is married for 3 years and has 1-year-old baby. And she is asking, will my baby get a rash? Can I continue going to the work? Will my husband get the rash? Will it leave a scar? So here, all these questions you are supposed to know by heart, because if you don't know the answer, then that means you're not a good doctor. You're not a safe doctor here. So you should know. So here the management point is very important, because the history is the same people. What you will do, ask, you will grip, you will start with the grapes. You will ask about the rash history. Where is it? What is the color of it? Is there any associated symptoms? And from where did it started? Now where is it? Is there any rash, any bleeding? Is there anybody else who has a similar problem? You will ask all the questions that I have discussed before. Then the associated symptoms, and then the childhood vaccinations, very important. And then the rest of the history. If only particular questions, don't waste too much time here. Just very particular questions like occupation, living, family history, and the previous medical problem, and any allergies or any medication she's taking previously. That's it. Not very much, okay? Because the management, you have to cover the management part here very well. And then you will mention about the concern. Do you have any particular concern? She might ask, I'm not going to the school, doctor. I'm a school teacher, and also I'm concerned about my baby. Okay, so when somebody asks some questions that you are not sure how to answer, because you haven't taken the much history, what you can say is, for example, the patient has asked me a question that can I go to the school, but I'm not sure because I haven't examined her that if she is able to go to the school or not. So what will I say? Well, Clara, I'm sorry to say, let me just ask a few more questions so that I can be in a better place to address your concerns. Okay, is it okay for you? So your tone must be like this, apologetic tone. So don't give such kind of statements you are not sure about. Okay, all right. So then will come the examination. You have to mention the examination, same head to toe examination. You should know that for your information, that impetigo starts with the red source or blisters, and the color is brown or some brownish, and it appears as the blisters. That is the golden brown patches, and that's it. Okay, and it might be itchy, but most of the time it is not itchy. It is just painless and non-itchy. It's the only thing that would be helpful to pick it is, it would be most commonly around the lips, and it would be honey-colored lesion. So the answer is, so from what you have told me and from my examination findings, I believe you have a condition that is impetigo. It is caused by a bacteria that lives in the shallow areas of the skin. It is very contagious, but not very serious. And it is quite manageable and gets better within 7 to 2 days. And then she will ask, will it heal without a scar? Yes, it will heal without leaving a scar. You don't need to worry about it. So the next is how you're going to manage me. So you have to mention, well, what am I going to do is, I'm going to prescribe you a cream, that is fusidic cream, that you're supposed to apply twice a daily for 5 days. But the very important thing is, do not stop the treatment even if the rash is getting better. That point is very important here, because 90% of the students are going to say, I am going to prescribe you the medicine, you are supposed to apply it twice a day for 5 days. Now the line that would make a difference is if you mention, please do not stop using this cream early, even if the rash starts to clear up. That's the line that's going to make a difference between you and between the rest of the people who would appear in the exam on that day. And then you have to mention that, well, as you have asked me that if you can go or not, well, I would recommend you that it stops being contagious 48 hours after you start using the medicine prescribed, or if you do not take any medicine, when the patches dry out and crust over, you can go to the school. But before that, you are contagious, the rash is contagious, and you are at the risk of spreading this to the others. So it's safe to be on a safe side. Please isolate yourself for a few days. Okay, and then do mention all, as because in the rash scenarios, I believe that you have to give the whole of the 4 minutes to your management, because the management points are very important here. You have to mention, well, there are a few things that you can do for yourself with that is, please stay away from the school or the work, keeps blisters clean and dry, cover them with the loose clothing, wash your hands frequently, wash the sheets and the towels at the high temperature, and that's it. And then there are a few don'ts, like do not touch or scratch your blisters. This will that will help stop scarring. Do not have close contact with your children or the people who have diabetes. Do not share the towels. Do not prepare food for the other people, and please do not go to the gym, and also avoid to play any contact sports. Now, then the patient might ask, if can I get it again? Yes, this rash can reappear. To avoid spreading the infection to the other areas or to the other people, or to get it again, what you can do is keep cuts, scratches, or insects bites clean. For example, by washing them with the warm water and the soap, and get treatment for the skin conditions like eczema. And then safety net. Well, in these scenarios, follow-up is not necessary, but do mention, well, the treatment that I have offered you, you will be fine within a week. But if you develop high temperature that is not being controlled, or you see that the lesion is spreading, there is a pain, or there is any bleeding or discharge from the lesion, you need to come back to us. Otherwise, there is no need for follow-up, and offer the leaflets. That's it. Okay. So that was the case of the Impetigo. Now the next is the ringworm. So people, same history, grapes, rash history in detail. Where is it? What's the color of it? And from where did it started? How many are they? And how does it looks like? And then the size of it, and then associated symptoms, and also the childhood vaccinations always, and also about if somebody else has similar problem, as I have discussed the questions in the approach. And then you will cover the rest of the questions, because here also very important, like what the patient is do, because if she goes to school, or if she is something that she deals with in public places, so you have to ask her to isolate herself to stop spread of this infection. So again, if you will mention the examination, the patient will give you this, examiner will give you this picture, and you have to tell that from what you have told me for examination, you have an infection that is the ringworm infection, which is a fungal infection, and it can be passed on through close contact with an infected person or the animal, with an infected sheets, or even infected soil. So what am I going to do is, I'm going to start you an antifungal treatment that you need to apply on the infected area twice daily for 1 to 2 weeks. And there are few do's and don'ts that you can do that is very important for you to know. So start the treatment as soon as possible. Do not share the towels. Please keep your skin clean, and wash your hands after touching animals or soils. Regularly check your skin if you have been in contact with any infected animal. And don't share the towels. Do not scratch the rash, because this could spread to the other parts of the body, of your body. Are you with me? Then the person might share the concern, well, I have a wife at my home and she's pregnant, so can I spread it to my wife? So can I spread it to my newborn baby? So you have to mention, well, I appreciate that you are very concerned about your wife. So, well, it is a fungal infection and you can spread it to your wife, but this is the skin infection, it will not affect the unborn. And if your wife even gets an infection, she can come to us and we will start her treatment. And let me reassure you, this is something that is treatable, and there is nothing to worry about. And you have to safety net. Like if it is increasing in size, or if there is any bleeding, please come back to us and then offer the leaflets. Otherwise, follow-up is not necessary. Okay, so the next scenario is the scabies. I want one of you to give it a go. Okay, so anybody wants to practice this? Anybody? Guys, if anybody of you wants to practice, I would be more than happy. No one? Okay, so all right, so let's move forward then if you don't want to. So FS, who is FS? Okay, sure. Okay, so you can unmute yourself. Let me just start the timer. Just a second. Hi, hello. Just a second. Let me just start timer for you. Okay. So your time starts now.
1 minute, or I have to start performing?
Yeah, you have to start your scenario. Practice. 7 minutes.
Hello, Dr. Fozia Shahid, GMC number 12345. Hello.
Hello.
My name is Dr. Fozia Shahid. I'm one of the doctors working here in the NHS. May I confirm your name, please?
Sure, my name is Mary.
And what is the name of your daughter, please?
Well, her name is Maria.
And can you confirm her age for me, please?
Yes, she's 5 years old.
Thank you. Good to see you,
Okay.
Maria. How can I
Yeah.
help you today, please?
Well, actually, she is crying, doctor. She's crying for the last 2 days.
All right. So is there anything that you have noticed?
Well, yes, she has, I think she has itch. She's actually having very severe itching for the last 2 days.
All right, Maria. And can you tell me a little bit more about the itching?
Like what?
As you mentioned, it is from 2 days.
Yeah,
So do you think it has got better, worse, or is it the same?
doctor, I think it is getting worse because she's crying now.
All right. And is there any rash anywhere on the screen?
Well, she has rash all over her body and particularly between her fingers.
All right. And have you noticed any bleeding,
No,
any discharge from this
no,
rash?
no, doctor.
All right, that's good. And any change in the color?
No,
All right. Any fever, flu, cough?
no.
All right, that's good. Any change in her eating habits?
No, she is eating well.
All right. And any change in her bowel habits like loose stool or constipation?
No, doctor.
Okay, that's good.
Okay, so
Caused her this itchiness?
sorry,
Do you think anything might have caused her this itching?
I don't know, doctor. I'm just very concerned because she's crying and being a mother, I can't see her like this.
Yes, I understand, Maria. It must be very distressing for you as a mother to see your child in such
Yeah,
a distress.
yeah,
I'm here to help you. Let me please ask you a few questions more
sure,
so that I can get a better understanding. All right.
sure.
Thank you. So, Maria, how is in the growth of your child overall?
Well, it's good. Like I'm satisfied with her development overall.
That's good. And what about her jabs? Is she up to date with all the jabs?
Yes, yes, doctor.
Okay, that's good. And do you have any other childs at home?
No.
Okay. And is there any past medical history, like she have any history of allergies?
No, doctor.
All right. And is she taking any kind of medications
No,
previously?
doctor. No, doctor.
All right. And is she having any allergy to any food stuff, dust,
Uh,
or anything else?
she's allergic to kiwi, I guess. Yeah, that's it.
All right. All right, Maria. So is there anything specific you are worried about today?
I just, yeah, I can just please tell me, can I send her school?
All right, Maria, that is a very valid concern. But let me ask you a further few questions, and once I have examined the child, I will be in a better position to answer you. Will that be all right?
Yeah, sure.
Thank you. Okay, I would like to check the observations of the child, and I
Okay.
would like to have a look at the rash
Sure, doctor.
and
Sure.
go ahead to do examination.
Yeah, sure. So here is it. It's kind of big
All right.
but
Okay,
still
Maria, from what
similarly.
you have told me and from examining the rash, I suspect that your child has a condition called scabies. Have you ever heard about it, or do
No,
you have any idea what it is?
no, doctor, what is it?
Okay, don't worry, Maria. It is a rash that is caused by a bug, which is mostly a mite that
Mm-hmm.
lives within the skin, and it
Okay.
causes a lot of itching at the night.
Okay.
But the good thing is it is treatable and manageable.
Okay.
All right. So
Yeah.
in terms of management, do you have any specific expectations from this consultation?
Well, I just want her to get better as soon as possible. That's what I want. That's it.
All right, Maria. So there are some things that we can do in terms of medications, and there are things that you need to do. Do you have any specific preference that we
Uh,
should discuss first?
yeah, please tell me the treatment options available first, please.
Okay, sure, Maria. So we have a cream that is called permethrin cream, and you need to apply this cream all above from the face, below the chin and the ear, and then leave
Uh-huh.
it for overnight.
Okay.
And then you have to wash it after 12 hours.
Okay.
Are you getting me?
Yeah. And what if you have said that if I have to apply her for over the night and if she washes her hand, what am I supposed to do then?
No problem at all. Maria, you can reapply the cream on that specific area. That is not
Okay.
an issue at all.
Okay.
2 minutes remaining.
All right, Maria. The most important thing is you need to apply this cream once, and then you have to repeat this after 1 week again.
Okay.
All right, and along with the child, you yourself, and if you have any other members, as if the father of the child or anyone else who lives in the home, they also need to apply this cream because
Okay.
it is a spreadable disease. All right.
Oh, yeah. And how long it takes to get better?
Okay, Maria, so your child can go back to work
Mm-hmm.
or, sorry, go back to school at least after 24 hours of the first treatment.
Okay.
And I would also like to add up that you yourself should not be going to work for the 24 hours after first
Oh,
treatment. Am I clear, Maria?
yes. And is there any complications associated with the scabies?
Usually, it is an uncomplicated disease, but in rare cases, that is very little bit few people can have skin infections like impetigo and certain sun conditions like eczema and psoriasis can make it worse.
Oh, okay.
Am I
Thank you.
clear so far?
Yeah, doctor. Thank you so much.
All right, Maria. So at the end, I would like to let you know that if the itching is persistent after 4 weeks and you don't feel like it is getting better and the child is having fever and he is not getting well, please come back to us at any time. All right.
Okay.
All right. Thank you, Maria.
Thank you so much. Okay, so Dr. Foze, it was good. Mashallah, it was too good. Only thing was you missed a few questions from the rash. I think I'm unable to recall them, but still the history was not complete. The management part was too good. Like it was too good. Your IPS was too good. You have to ask about the P-bin complete history. Like whenever comes the patient, like whenever comes a child, a children, when you're asking about the rash history, and when the patient mentions that it is itchy, you have to ask like, is there any particular time of the day when it gets worse? You have to ask that question.
Right.
And then also ask one thing, have you noticed that it disappeared after some time? Because in that way you will rule out the utic area as well. And then
All right.
do ask about the pregnancy history, like P-bind history, like P-bind history, like in which you will ask like, how was the pregnancy? Was there any complication? How was the delivery of your child? Did the child need any special attention? And then you have asked already about the vaccination history, about the nutrition. That was good. You have asked about the development, and then the history you have covered very well. So yeah, that's it. Now the rest of the people. So, for you, Fozia, Dr. Fozia, mashallah, your task
How
was,
was my tone? Would you comment on my tone? Did I
it
sound
was good.
monotonous?
No, yeah, it's kind of a little bit monotonous, so what you can do is, that was the point I was coming to, that you need to work more on your tone, because when you are discussing something important, there should be a change in your tone. Otherwise you sound monotonous, like it's kind of like you are expressionless towards the patient, or it's kind of like your tone is empathic or sympathetic towards the patient. You should have work on your tone. There should be ups and downs in your tone, so you need only to work your tone. Otherwise I think your time management is good. You are already know all the points related to the scenario, like that one, because I have practiced this one with you. So you have to work on your tone, because kind of like you are expressionless.
Okay, thank you so much,
Picture of
doctor.
that.
Thank you.
You're welcome. Okay. So the management, first of all, as the child was 5 years old only, you have to ask about the P-bind history as well as palm go. Whenever the child comes with whatever problem, I have missed that point, you have to cover the history. For example, you have to ask about, has the child developed any fever? Has the child has any flu? Any discharge from any pain or discharge from the ear? Any change in her bowels? Or any shyness from the light? These 5 particular systems must be covered whenever a child comes with any kind of problem in your practice. And then you have to ask about the P-bind history, like pregnancy, delivery, immunization, development, and nutrition. And then the past medical illness, any previous hospitalizations, any allergies, any medications, that's it. And then you will ask about the mother's concern, and then you will mention the management as you used to do in the previous cases. And then the management is the scabies. So you have to mention that I'm going to give you 5% per methylene cream, and the way she needs to apply is very important. So what you need to do is, you need to apply this cream to your child below the chin and the ear, over the whole body, and leave it over the night, and wash it after 8 to 12 hours. The most important thing is, the whole family needs to be treated irrespective of the lesion, because it is highly contagious disease. And you need to repeat this after 1 week. And things you can do during the treatment to stop scabies spreading is, wash all the beddings and clothings in the house at 50 degrees or higher. Put clothing that cannot be washed in the sealed bag for 3 days until the mites die. Stop scabies, babies and children sucking treatment from their hands by putting soaks or mittens on them. And there are a few don'ts, like do not have sex or close contact until you have completed the full course of the treatment, or do not go anywhere. Do not share the bedding with someone with scabies. So the next question was, how long will it stay? So you have to mention that you or your child can go back 24 hours after the first treatment. Although the treatment kills the scabies mite quickly, the itching can be carry on for a few weeks. So you have to mention that point. Scabies can spread easily. It can pass from person to person by skin to skin contacts, but you cannot get the scabies from the pets. People who live or closely work together in the nurseries, universities, halls of the residency or nursing homes are more at the risk. So anyone can get the scabies. It has nothing to do with the poor hygiene. Like this point, why I have covered it here, because there is a chance that the patient might ask this question. So that's why I have mentioned all the points, so you should able to know and to answer these particular questions. And then comes the complications. But complications could be, if a person is having any skin problem, it can make it worse. And the safety net is, if your skin is still itching, like if your baby's skin is still itching for 4 weeks after the treatment has finished, you need to bring him back. Otherwise there is no need. That's it. So yes, Dr. Fozia, you have a question? No problem. Dr. Fozia, you have raised your hand. Okay. So the next comes is the measles, and then the chickenpox. People, same history. You will ask about the same. Okay, so I got another question. No, thank you so much. All right, you're welcome, Dr. Fozia. Okay, so the next is the measles, people. So what the measles says? There's 25-year-old who has visited you 30 minutes ago with the rash, and she had to go back to her hostel before the nurse has taken the picture, talk to her over the phone and address the concern. So the patient has visited, the nurse has taken the picture of the rash, and now you are calling the patient. Okay, so you have to take the history on phone. So I believe that you all know the approach. Whenever you are dealing with the patient on the phone, there are a few things you have to cover. For example, first of all, you need to say hello, then ask, can I confirm whom am I talking to? Confirm whom you are talking to, the person who is opposite. to that. Okay, and then introduce yourself that I'm Dr. This, working in the this department. Let me confirm a few details of yours. Then ask about, let me confirm your full name, your date of birth, and the first line of your home address, and then proceed with your further history. I believe Dr. Junaid will discuss with you people the approaches over, if it is online approach, if it is on phone approach, if you are calling to the patient, if the patient is calling you, how you're going to approach this. He will discuss it with you later on. But just in one line, that if you are calling to the patient, you have to first of all greet, hello, just say, and then confirm. Can I ask whom am I talking to? She will mention that I am this. Then confirm. Then introduce yourself. Well, I am this, working in this. Introduce yourself and then say, well, I need to confirm a few details of yours. Please tell me your full name, your date of birth, and the first line of your home address. Okay, and then proceed with the next questions. Now you will ask the same questions, that like rash questions, all the same questions. Where is it? From where did it start? Now where, because the patient will you will ask from where did it started. She will mention in the first start it was behind my ear, and now it has spread it all over my body. So by this you will get the cue that this is measles. And then you will ask about the rest of the questions, any discharge, any itching, any associated symptoms, and childhood vaccination. She will mention that I am not sure that I am not sure that I had an MMR or not, or she will say that I never had MMR. Okay, so vaccination status is important. And you will ask the rest of the questions like diabetes, blood pressure, any allergies, any medications, any contact history, occupation, like what she do, like according to the age you will ask like what do you do and for living. And if she says I do not do anything, then you can ask, do you study? Then she will mention, yes, I'm a student and I'm preparing for my papers or whatever. And then you need to ask, is there somebody else around you who has similar problem? Ask about the particular concern. The patient might say that I have exams in the upcoming weeks and I'm very concerned because of that. Am I able to go? So you have to mention that I can see that you're very concerned about your exam. I really appreciate that, but I need to ask a few more questions so that I would be able to answer your query. Is that okay for you? Just bear with me for a while. Okay. Then proceed. When you will mention the examination, the patient will give you the picture. It is not clear right here, I think, but you can see it on the Google as well. And then you just mention the management. The points that important in the management is you have to mention that it is a self-limiting disease. It is contagious, but it is a self-limiting disease and it is caused by a virus, and it usually starts to get better in a week. And what you can do is we can start the patient on symptomatic treatment. You are supposed to take rest and drink plenty of fluids to keep yourself hydrated. You can use paracetamol to relieve if you have any temperature, and you can use the soaked cotton, soaked wool in the warm water to gently remove any crust if it gets on your rash, because sometimes it is really disturbing. And please do not go to the work, or if the patient goes to the school, please do not go to the school for at least 4 days from when the rash first appears. And please try to avoid contact with the babies, people who are pregnant, and people with the weak immune system, because measles can spread from person to person easily. So here are the things that you can do to reduce the risk of spreading. Wash your hands often with the soap and the warm water. Use the tissues when you cough or sneeze. That is very important to maintain the hygiene. And please throw the used tissues in the bin. And do not share the cup, towels, clothes, or bedding. That's how you can prevent it from spreading to the others. You can ask, are there any complications? Well, yes, it can lead to serious complications, but it is very rare. It can cause pneumonia. It can cause swelling in the brain. It can affect your vision, and it can even cause fits. And also mention that I need to report to the local health protection teams, as it is a notifiable disease, and I'll inform my seniors as well. So for the measles, it is very important to mention that you are going to notify to the local health protection teams. And the patient concern was, I have exam and I have to go to take my exams. You have to mention, when is your exam? She will mention this, like show your concern. Then she will say, well, I appreciate that, and I am happy to see that you are too much concerned about your studies, but here is a thing. Actually, Clara, measles usually resolves within a week and you will be able to take your exam. But for now, you can attend the classes via online platforms. You should stay away from the school right now. I can also send you some sick notes. I just missed the word sick notes. Like you can also offer the patient the sick notes because that's way you are covering the IPS part as well. Then safety net against the high grade fever, shortness of breath, or any fits. And if you develop any kind of symptoms, please come back to us or call 999 and then offer the leaflets. Okay. And also mention one more thing. When once you get better, please come back to us so we can discuss your getting an MMR vaccination to prevent it in the future. So all these points are very important to be covered. So you can see people, because you should know that, for example, if there are 10 to 15 people who are going to appear in the exam on that particular day, the passing percentage would depend on the performance of all the 15 students. Okay. So it depends like how many persons, how was their performance. If for example 10 to 11 people in a particular scenario have performed 80% plus, like regarding their performance basis on their percentage, so that means the passing score would be high. But if the scenario was already difficult and only 3 to 4 people were able to go above 80% in their performance rate, if we say, then the passing rate would be the passing ratio, the passing percentage you need to take would be low, or the passing score you need to take would be low. So it's always depends on that particular day, how many people and how much are they good in that particular scenario, and how good they perform in that particular scenario. Okay, so please learn the point that makes a difference between you and the performance of the other people's. Okay, so the next is the chickenpox. Everything same. Baby is small. The only difference is the appearance in the rash, and also it starts from the face and then comes to the body. So you will cover all the points similarly, same history. You will ask if they have already given the name of the baby. Most of the time they have already mentioned, if the baby is the patient, they will mention the name in your stem. So you have to confirm the relationship. Like, can you confirm how you're related to Joshua? And then cover the rest of the history, like all the related to the rash history questions, associated symptoms, then cover the P-bind, palm goo, MAM, like previous medical history, allergies, any previous hospitalizations, and any medication she's on. And then ask about, is there anybody else who is having similar problem? And then cover the examination, and then you will explain it explain it the same, that based on your sign and symptom, I believe that your child is actually having chickenpox, and it is very commonly affects the children. And what we're going to do is we will give some symptomatic treatment. You will need to keep your child away from the school and nursery until all the spots have formed a scab. This is usually 5 days after the spots appear. Are you following me? There are a few do's and don'ts that are really important to be taken care of. Like, please give plenty of fluid to your child to avoid dehydration, because there is a risk of dehydration. You can give paracetamol to Joshua to help with the pain and discomfort. Cut your child's fingernails and put the socks on their hands at the night to stop them from scratching. Otherwise, they might develop scarring. You can use antihistamine medicine as well to help with the itching, and give bath in the cool water and pat the skin dry. Please do not rub, and dress in the loose clothes, and please do not use ibuprofen until advised by the doctor to do so, as it may cause serious skin infection. So please try to avoid that in this time, and do not give. All right, so that is actually for you to know, that if the patient is less than 16 years, do not give aspirin. That is for you to know, as being a doctor, to know. Please do. Okay, so yeah, and please keep a distance from the newborns, people who are pregnant, people with the weakened immune system, chickenpox, and that's it. And offer the sick note to the child and tell her that he's not allowed to go to the school because he can spread to the other people as well. Safety net is for bacterial infection, superimposed bacterial infection. So say if he develop high temperature and the redness around the original red rash, you need to bring the child back. Okay, and reassure the mother that it is a self-limiting disease and will resolve within 1 week. That's it. Then offer leaflets. That's the end of our today's session. So if anybody of you has any particular question, you can ask. And I have seen that there are a few mistakes in my notes, and I'm going to correct them, and I'll send you the updated ones in a while. So any question you people have till now? Have I made everything clear to you people? Because your feedback is very important for us. That's it. So and I believe that if you people are not responding, that I believe that I have made everything clear to you people. So this is the end of our session. I'm going to end the meeting, and your feedback would be really appreciated. Thank you so much for your patience actually. So good luck with your exam. If you have any query, you can text me anytime. I'm available 24/7. Good luck people. Bye bye.